I'm Todd Rosengart, professor and chairman of the Michael E. DeBakey Department of Surgery at Baylor College of Medicine. The care that you as a patient of Baylor College of Medicine and the Michael E. DeBakey Department of Surgery should be an expectation that that care is second to none. We care about our patient as a whole, our families as a whole. And not only do we want to make sure that our patients do well from a physical and physiologic standpoint, we want to make sure our patients and families do well from an emotional well-being and a recovering to get back to normal life standpoint. So all of those things are very important to us, and we strive our very best to make sure we accomplish that. So the Department of Surgery is really a jewel. It is, and we want it to continue to be first in class, absolutely the very best that you can find anywhere. We think both in terms of how we view ourselves and our national reputation, we really have achieved those goals. Whether you're talking about thoracic surgery, vascular surgery, transplants, more often than not, we are not only the very best in terms of quality, but we're also one of the very busiest programs in the entire country, if not the world. So nothing to me is more important as chairman, again, is to know that we have the absolute best who we can rely on, and having that assurance and that knowledge that we do have the very best is both a wonderful privilege and an opportunity, but also a fantastic part of the experience being here at Baylor. What we're able to do in terms of surgery today is much different than what we could do 10 or 20 years ago. Not only can we operate on sicker patients, but we can take care of them better, with better outcomes and better results than even 5 years ago. So for example, when I was a junior faculty member or resident, the chance of dying with open heart surgery was typically in the 10 to 20% range. Many patients think it's still those numbers, still that high, and in fact, it's just the opposite. A typical open heart operation today on a relatively low-risk patient, the chance of you're doing well being out of the hospital in 4 or 5 days is about 98 or 99%. Those are staggering numbers. I don't think they're well understood, but we've gotten so good at what we do, and that's not just with the surgery, but the overall ability to take care of our patients has allowed us to achieve those results.